It's Mari McInerney from Croaky here, and I'm at the World Indigenous Cancer Conference talking to one of its keynote speakers. Linda, could you introduce yourself, please?
Yes, I'm Linda Burhansstipanov. I'm Cherokee Nation of Oklahoma, and I'm very happy to be here.
We're very happy to have you here, and we spoke to you actually in 2016 at the very first week, so it's fabulous to catch up again. Could you talk about, because you've been involved in cancer control and treatment for many, many years.
Yes.
I won't ask exactly how many, but what got you involved and what keeps you motivated? Because it's a hard slog at times.
I got involved unwillingly. I was not interested in cancer at all, and I had a very negative exposure to research, so I wasn't interested in that. And my stepfather, whose name I carry, was diagnosed with cancer and ended up having both lung and kidney cancer, and he was such a blessing in my life. I just realized how little information was out. So that was one step, and the other was James Hampton, who was the very first American Indian oncologist in the United States. And we were at a meeting in San Diego, and we were talking, and at that point I was doing work with HIV and AIDS, and I had worked with women's issues, rape, domestic violence, and so on. And he said, "You need to go into cancer." And I'm like, "Yes, grandfather." And it was like, you know, Creator gives you, he gives you so many clues for what you should doing, and those were two powerful clues. And I immediately changed the whole way my professional life went.
And it's been decades?
Since 1989 is when I had the conversation with Dr. Hampton, or 1988. Then I went to work for the National Cancer Institute and started the National Native American Cancer Research Program for them from 89 to 93. Yeah, so I'm an oldie.
You're an oldie. So tell me, have you seen progress?
Oh, heavens, yes. You know, when we first started this program, there were basically less than 5 programs out of 574, now it's 574 federally recognized tribes. They had diabetes, they had substance abuse, alcohol, but only about 5 out of all of those did anything at all related to cancer. There was tobacco prevention control, but it was tied into cardiovascular, to respiratory, and cancer. And so there was a gradual shift. And what a difference from where things were in our country and in other countries, looking at indigenous health. And Gail and Linda Krebs and I were all at the UICC, and that's where Gail got the idea to start the WICC. Absolutely phenomenal gathering. There's just such a difference when indigenous people are holding their own gathering. The spirit, as soon as you walk out of the elevator, you can feel it in the way people talk and how friendly they are and how they meet, in the support, in the willingness to help one another with their programs. So at the WICC, what was very surprising to me was so many of our American Indians who attended who didn't have any knowledge of indigenous cancer issues in Australia, in New Zealand, in Guam, and other areas, Pacific Islands, and it was I was kind of dumbfounded at how little information exchange there had been until Gail started it. And what a pleasure. And now what we see is people being more interested in a lot of these different efforts in different countries. The types of cancer that we have seen in indigenous people in the United States, both the contiguous 48, Hawaii, Alaska, everything when I first started research was so far advanced. A good 1/3 of cancers were unspecified site. They didn't know what the original or the primary site of the cancer was. And we rarely see that anymore. It occasionally happens, but not much. We are seeing more in situ or stage 1, and I'm sorry, in situ stage 0, stage 1 and stage 2. Earlier diagnosis, the greater likelihood for successful treatment, quantity and quality of life, and it's wonderful. We have people in our local survivorship circle. We've had one since 2001, coordinated by Lisa Harjo. And we have patients who are 30-year survivors in our support group. You know, whereas when I started, we didn't know if we could even put cancer in the name of our organization. And our community said, oh no, you're going to get cancer. And at that time, we started with breast cancer, as so many programs did. And we said, well, you know, there are 8 of us women, 1 out of 8 women develops breast cancer. It is likely one of us is going to develop breast cancer. But it's due to the disease, not because we said the word on it. And so that was really important. In terms of the progress, what I have been very happy to see is when most of our programs started, they're with solid tumors, breast, cervix, colon, colorectal, or bowel, as you say here, lung, and prostate. But our people get all types of cancer. And so we have to have programs that support people regardless of that. We still are very minimalistic in what we do for childhood cancer and adolescents and young adults with cancer, both for these young people diagnosed and for the support for their family. We have so much more to do. The nice thing is it's being talked about more and more, and hopefully we can start to make some progress in these areas too.
And where you have seen progress, what can you ascribe that to? What's working?
What's working are, in my very biased opinion, is having local Indigenous programs throughout the country. National celebrities are wonderful, but to really get the message home, it is a local Indigenous person. To have one say, I am Mary Lou, I was diagnosed with lymphoma, and I recommend you do blah, 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 blah. That's it. That's what makes the difference. Local leadership, having traditional Indian medicine included. We find that, I'm going to say, almost all of our patients combine Western medicine with traditional Indian medicine. All of them do better than the Western medicine prognosis, all of them. Now, it's very powerful that we build on the strengths in our community, and there are so many strengths, so it's really wonderful.
That was one of the messages you gave in your keynote today or yesterday, hard
to remember.
Yesterday, where you said, look beyond the data, look into people's eyes and hearts. What did you mean?
There is nothing more rewarding, in my opinion, than working with cancer survivors. They're so strong, they're so funny. And the approach going beyond, people so often think, I'm a cancer survivor, and cancer defines them. And I think we all go through that for a period, regardless of what the disease is. But you get to a point where you realize, I am who I am, and I'm of my people, and I'm a strong person, and I have passion. When you get to the point where you start helping other people in your community, you become what we call a thriver. And we find when people make that transition, literally, there is a shift in their spirituality, there's a shift in their body, mind, emotion, social interactions, everything. And their recovery is phenomenal. And it literally is like it's a leap when they get to the point where they're ready to honestly help other people. It's very healing.
How does the health system
How does the what?
How does the health system enable that? How does it encourage it? Or does
I
it have a
don't-
role?
I don't think the health system encourages it. I think our cultures encourage helping one another because that is what we've always done. You look at the situations and how we have lived, and you have to work together with your community to survive. And cancer is no different. One of our survivors, yes, it is, can survive is what's important about the journey. And we're doing better. We still have a way to go. But there's no reason for anything to stop us. Yeah.
And now if I can apply that no reason to stop to your work, you've been involved in the book with Gail Garvey.
Yes.
I think it's on Indigenous and tribal cancer.
Yes.
It has 77 chapters.
Yes.
How do you keep up the energy and the motivation for this work?
I love what I do. I love the people. I can't imagine not working. I mean, I'm older, and my husband keeps saying, well, do you think you want to retire? And I'm like, I don't see it in the future. I'm only 74. It's like, no, I don't need to. It is something I love getting up in the morning. I look forward to work. There's hard parts. You have difficult conversations with survivors or with their loved ones. But it is so, it's like you're not always going to feel this way. You're going to feel better. And that's an important message. And it's so wonderful when you get a call back from someone that you've been able to help. And they'll say, you know what? I didn't believe it at the time, but now I understand, and I'm doing it, and I'm getting exercise, and I'm feeling better. I'm eating better, and I'm gonna see my grandchildren finish school.
Yeah, it's amazing.
Yeah.
Thank you. Is there anything that you'd like to say about being here, or in general, or messages for the health system? Or
I think one of the messages, and it's after doing research for over 40 years on cancer within our community, one of the things that we found has been essential is having Native patient navigators be well trained and to carry out the programs, the interventions within the community. We look at all the different types of approaches, and that was good, and that was good too, and that was good. But the consistent impact and the power is having local Native patient navigators delivering the message, working with the community, bringing them in for early detection screening, or our walking program, or our healthy eating program, or our recipe program, whatever it is for prevention, and having the navigator be a consistent person all the way through from outreach, and taking them into screening if they're diagnosed. That person's still there, so you have continuity instead of just being bombarded with sometimes 20 different healthcare providers. But that's my Native sister, and she's going to help me all the way through, and it works. It works. So that's why we have invested so much in both training and evaluating navigation on patient outcomes, and we see the patient outcomes better.
Fantastic. Thank you so much, Linda.
Well, sure.
Again, see you in 8 years.